Hi everyone, my name is Janina Ramos. I am a student in the nursing education program at Malloy University, and I did my research project on postpartum falls. Postpartum falls are a growing patient safety concern linked to anesthesia use. Neuraxial anesthesia, such as an epidural, is commonly used in labor. Neuraxial anesthesia can cause temporary motor weakness and impaired balance in patients, which can then increase the risk for falls during the recovery period for mothers who try to ambulate. My problem statement is as follows. There has been an increase in the number of falls among postpartum mothers during the recovery period in Manhattan hospitals in 2025, with anesthesia use being a contributing factor. As a labor and delivery nurse in Manhattan, I have seen postpartum patients experience falls when attempting to ambulate or get out of bed during the recovery period. A common factor that these patients had was the use of an epidural for their delivery. The residual effects of neuraxial anesthesia, such as motor block and sensory deficits, are often underestimated by patients and by the staff. I have also noticed that there are limited tools and interventions in the unit that could be used to prevent falls among the OB population. This experience has motivated my interest in identifying more effective safety measures for postpartum patients. This topic is important to nursing because it impacts maternal safety and the quality of care of mothers in the recovery period. Postpartum mothers face an increased risk of falls due to physiological changes and fatigue, and also residual motor weakness from neuraxial anesthesia like epidurals. Falls may result in physical injury, delayed healing, emotional distress, and increased hospital length of stay. Some nursing interventions can improve mobility protocols, enhance patient education on safe ambulation, and strengthen postpartum fall risk assessment tools. The results of the study has the potential to benefit postpartum patients recovering in Manhattan hospitals by helping to reduce the incidence of falls and improving the patient's safety and well-being. The results of the study would also benefit nurses because they would benefit from evidence-based strategies that can help them handle patients at risk more safely. And lastly, the results of the study would also benefit quality improvement teams because they can use the findings to better refine policies for patient safety. Warren conducted a study to determine whether the return of motor function in lower extremities can serve as an indicator for safe ambulation in postpartum mothers who received epidurals. The observational study examined 100 obstetric patients with an epidural. Nurses then assessed deep tendon reflexes and motor strength using the motor strength scale before and after epidural anesthesia and before ambulating. Data was collected on 100 subjects, and the results showed that 91% of the patients successfully ambulated without falling, 9% required assistance during ambulation, and there were no falls. Warren demonstrated that assessing the return of motor function after epidural use helps nurses determine whether a patient is ready to get out of bed and helps increase patient safety. The study addresses a relationship between epidural and falls in postpartum mothers. Riso et al. Showed that obstetric fall risk tools can improve nursing clinical judgment. They found the post-epidural fall risk assessment score was effective in measuring fall risk related to epidural anesthesia and postpartum physiological changes. They concluded that maternity-specific fall risk tools can improve nurses' clinical judgment and help them practice fall preventions with patients. This article is useful because it connects the research variables, the incidence of falls and the incidence of epidurals, and it helps set a foundation for understanding how fall risk tools measure these factors. The study by Lam et al. Examined 60,796 hospitalized patients who received anesthesia over a 5-year period to determine the incidence and risk factors for falls happening within a 24-hour post-anesthesia timeframe. The researchers found that a higher risk was observed in older adults and in patients who received regional or IV sedation anesthesia. This study demonstrated that residual anesthesia effects can impair mobility and increase the chances of early fall risk for an epidural. The longitudinal study by Chen et al. Demonstrated that the root cause analysis approach to fall prevention reduced the incidence of postpartum falls in the intervention group from 14.24 to 6.02 per 1,000 patient days. The evidence supports its usefulness in helping quality improvement teams adjust policies and practices to better protect postpartum patients during the recovery period. My research question is as follows. Is there a correlation between the incidence of falls and epidurals for postpartum mothers during the recovery period in Manhattan hospitals? Based on the study principles, this study is researchable. The study has social and clinical value because the question being addressed has practical relevance for improving patient safety in postpartum mothers. The study is researchable because the variables can all be clearly defined, measured, and analyzed using quantitative methods. The study has scientific validity because it will propose a clear answer to the research question. Data related to postpartum falls and epidural use are documented in hospital records. The study focuses on measurable variables with the specific population and setting, and the relationship between the variables can be examined. Therefore, it meets the criteria for a researchable study. This study will be classified as applied research because it aims to address a current clinical problem and produce evidence that can improve patient care. The research approach would follow a quantitative correlation design because it seeks to determine whether a relationship exists between the two measurable variables. The independent variable is the postpartum mothers during the recovery period in Manhattan hospitals. The dependent variable are the incidence of falls, which can be measured by hospital incident reports, and the incidence of epidurals, which can be measured by patient medical records. My hypothesis statement is as follows. There is a correlation among the incidence of falls and epidurals for postpartum mothers during the recovery period in Manhattan hospitals. This is a directional hypothesis where the researcher predicts the expected direction of the study. The research framework centers on the independent variable, which is postpartum mothers during the recovery period in Manhattan Hospital, and examines the relationship to the dependent variables, which are the incidence of falls and the incidence of epidurals. The framework supports the idea that epidural anesthesia may contribute to fall risk and that analyzing their relationship can help inform safer clinical practices for postpartum patients. The research will follow a quantitative correlation design, which is appropriate for determining whether a statistical relationship exists between the variables of interest. This design allows the study to evaluate whether epidural use is associated with an increased incidence of falls among postpartum mothers in recovery. All variables can be measured objectively through hospital incident reports, anesthesia documentation, and electronic chart audits. Data will be collected from electronic health records over a specified time frame, so January 2025 to December 2025, and analyzed to determine whether epidural anesthesia is related to fall events among postpartum mothers in Manhattan hospitals. Correlational analysis will be used as the primary statistical method for this study. This approach is appropriate for determining if a relationship exists between epidural use and postpartum falls. Both variables are measurable and objective through hospital records, which allows for accurate and objective statistical comparison. I hope to disseminate the findings of the study by submitting them for publication in a refereed journal. Sharing the results through an academic publication will help 1. Increase awareness of postpartum falls, and 2. Support clinicians, researchers, and educators in applying findings to practice. The goal is to improve maternal safety and enhance fall prevention strategies in postpartum units through evidence-based care. Thank you.